This is the Daily Medical News by MD Edge, where we bring you the top stories in clinical medicine, followed by a deeper dive into the day's top story. Today is Monday, October 7th. I'm the voice of MD Edge Podcasts, Nick Andrews. Coming up later, we'll take a look at the overuse of corticosteroids in patients with severe asthma. Before we begin, a quick look at what's coming up this week on MD Edge Podcasts. As some of you know, we have a network of 6 podcasts, including Blood and Cancer, which is the official podcast of MD Edge Hematology Oncology. This week, Dr. Alana Yurkowitz finishes the 3-part series on hard clinical conversations for trainees. You can find a link to Blood and Cancer in the show notes. It's time now for the top stories in clinical medicine. We begin today with updated data on the vaping-associated lung injury case numbers. More than 1,000 cases of vaping-associated lung injury have been reported in 48 states and the U.S. Virgin Islands. This is according to updated data from the CDC. Dr. Ann Shukat is the Principal Deputy Director of the CDC. In a briefing, she reported that there have been 18 related deaths in 15 different states and that there are additional deaths that are currently being investigated. The CDC also reports that of the 1,080 cases that have been identified, over half reported used vape products in the 90 days before the onset of their symptoms. Of these patients, about 78% reported using vape products that contained THC, and another 37% reported using THC exclusively. Dr. Shukat said that THC products do seem to be the most commonly used, but these products don't seem to be the only culprit. A September report in the New England Journal of Medicine found that THC products that were bought off the street were commonly used by patients with lung injury. Using NSAIDs continuously could increase the risk of incident hypertension among patients with ankylosing spondylitis. This is according to the results of a prospective study published in the Journal of Arthritis Care and Research. The study also appeared to show that the tumor necrosis factor inhibitor therapy could increase blood pressure. However, this finding was not statistically significant across all methods of analysis. In the study, researchers evaluated data from 628 participants. Of these, 200 patients used NSAIDs continuously. After a median follow-up period of 7 years, the researchers report that 129 patients from the entire cohort developed hypertension. This translated to a statistically significant hazard ratio of 1.12 for continuous NSAID users compared with non-users and those who said NSAIDs intermittently. This relationship did not differ across subgroups defined by age, disease activity, BMI, or TNF inhibitor use. And health policy analysts have mixed views about whether Tennessee's proposal to turn its Medicaid funding into a block grant could benefit or disadvantage the state should it be approved. Governor Bill Lee submitted a draft to the Trump administration requesting that the government convert the federal share of the state's Medicare funding into a $7.9 billion lump sum. Under the proposal, the federal spending cap would apply to currently eligible children and adults, patients who are covered based on disability, and seniors who are currently eligible. However, it would not apply to newly eligible patients, prescription drugs, dually eligible enrollees, and reimbursement to disproportionate share hospitals and critical access hospitals. Governor Lee argues that the grant would increase efficiency in the state's Medicaid program and generate significant savings, which the state would apply evenly with the federal government. The Daily Medical News will be right back after this. And welcome back to the Daily Medical News. I am Nick Andrews. It's now time for an update on the measles situation in the United States. It looks like most cases occurred in close-knit communities with low vaccination rates. In total, there were 1,249 cases of measles reported in the U.S. at the time of publication in October. That makes this year the most active year for measles since 1992. That's according to CDC Morbidity Mortality Weekly Report. There were 22 outbreaks reported in 17 states in 2019, but the majority of cases occurred in a pair of outbreaks that started in 2018, one in New York City and the other in New York State. These 2 outbreaks occurred in under-immunized, close-knit communities and accounted for 934 cases in 2019, which is equivalent to 75%. And finally today, 1/3 of patients who have severe asthma are overusing corticosteroids. The serious adverse events that patients with severe asthma face when taking maintenance or rescue corticosteroids might be avoidable. That's if data from a recent Dutch study are representative. The study was presented at the 2019 Annual Congress of the European Respiratory Society in Madrid, Spain. It was presented by Dr. Katrien Egar, who is a researcher at the University of Amsterdam Medical Center. She said that the main message from the study is that corticosteroid overuse is both common and unnecessary in the majority of asthma patients. In the study, Dr. Egar and her colleagues analyzed more than 2,300 patients who were on high doses of inhaled corticosteroids and who responded to a questionnaire. High dosage was defined as at least 500 micrograms per day. Using pharmacy data, the researchers determined that 29% of these patients were taking harmfully high doses of rescue oral medication as well as high doses of inhaled medication. The researchers determined that 48% of patients with harmful oral exposure were found to not be adherent to their prescribed inhaler medication. And of those who were adherent, 54% were found to not be taking their inhaled corticosteroids appropriately. When these numbers are put together, the data suggests 78.1% of high oral rescue steroids users are either non-adherent or using poor inhalation techniques, which means that there is a big potential for treatment optimization. Dr. Egar said the overall evidence is that not enough is being done to ensure that asthma patients are being protected from the risks of rescue oral steroids. She cited evidence that adverse events associated with these medications begin with a cumulative lifetime prednisone equivalent exposure of only 500 milligrams, and she believes that clinicians should be more aggressive in intervening. She emphasized that steroid-sparing alternatives are just one strategy to reduce exposure to oral rescue corticosteroids, and that patients who are adherent to prescribed inhaled steroids and that patients who are using them correctly could have an even greater impact. And that's it for the Daily Medical News for Monday, October 7th. Remember, you can find links to these stories in the podcast notes. For MD Edge, I'm Nick Andrews.